There will be more people wander in as the next little time goes by, but we do have a schedule to keep, so we are going to get started. I just want to welcome everybody here to this year's conference, and my name is Bruce Fiddler, and I'm SUMA Director for the Northern Region. A couple of things that I have to cover off before we get started. With the safety procedures for us down here, in the event of an emergency, this building is equipped with alarms that will sound and strobe signals that will flash. The building alarm system has two stages. First stage is warning, intermittent ringing, and strobe lights flash. Second stage is evacuation, which is a continuous ring and strobe lights. And you'll be guided by TCU staff and announcements for the evacuation. And please make your way calmly to the west exit onto 22nd Street or use the stairwells, which are marked with exit signs, and do not use the elevator. If you are mobility impaired, you'll be assisted by TCU Place staff, and remain outside the building until you are advised by staff that it is safe to return. There are 3 exits from our Centennial Hall level. It's up the west stairwell where you came in from the main lobby, through the east fire doors, and through the south via the kitchen. And also, just to advise everybody that the sessions are being recorded, audio recorded, and people that are going to ask questions throughout need to step up to the microphone, speak clearly, introduce yourself and where you're from, and everything will, I'm sure everything will go fine. Our session today is Heart of the Matter, Reducing Crime with Regional Hubs. Regional hubs are a holistic approach to reducing crime. They bring together advocates from enforcement, social services, and health, with a variety of other care workers to determine solutions to rehabilitate offenders rather than merely punishing them. This session will explore the province's new hub strategy, including an overview of the pilot projects already completed and a roadmap of future hubs. Our presenter today is Matthew Gray. Matthew is a member of the Prince Albert Police Service, currently as a consultant to the Government of Saskatchewan Ministry of Justice, building partnerships to reduce crime. With 16 years of policing service with the Prince Albert and Edmonton Police Services, Matthew has worked in various aspects of law enforcement, specializing in crisis negotiation and incident command, and has participated in several community policing initiatives. It is his participation in the development of Community Mobilization Prince Albert and the nationally recognized hub model, however, that has been a career highlight. Let's welcome Matthew.
Thanks very much. Well, good afternoon, everybody. Can everybody hear okay? First off, this is my first opportunity to speak to a group such as this. Typically speaking, we present a lot more to front-level service providers, their management, but I'm quite actually excited to speak to some municipal governance right now, because I'm really, really curious to take away your take on this and your thoughts and that type of thing. So I said to Mr. Fiddler beforehand, if you have a question, you don't have to park till the end. I do have a slide deck to refer to, but it's been my experience with this presentation that people get more takeaways by being actually involved in it. So first things first, for our role-playing session, I'm going to need about 3 volunteers, one to be the police officer, one to be the person in crisis, and I'm totally joking. There's no role-playing. I just wanted to see how many people were going to grab their jackets and run for the exit. So thanks for that. So building partnerships to reduce crime. It's a tough thing to describe exactly. We're not exactly a unit of government, but we are housed in government. out of the Ministry of Justice. I really wish we could take the word crime out of our moniker, because it was born out of a crime prevention strategy, but quite frankly, it has really evolved into something much, much more dynamic and much more inclusive of all the human services, not just policing. It got its start in policing, but make no mistake, we are about community safety and wellness. We are not about crime. There's a benefit of reduced crime, but that's not our whole target.
It was many years ago when the villagers downstream recall spotting the first bodies in the river. Some old-timers remember how Spartan were the facilities to manage that sort of thing. Sometimes, they say, it would take hours to pull 10 bodies from the river, and even then only a few would survive. Though the number of victims in the river have increased greatly in recent years, the good folks downstream have responded admirably to the challenge. Their rescue system is clearly second to none. Most people discovered in the swirling waters are reached within 20 minutes, and many in less than 10. Only a small number drown each day before help arrives, a big improvement from the way it used to be. Talk to the people downstream and they'll speak with pride about the new hospital by the edge of the water, the flotilla of rescue boats ready for service at a moment's notice, the comprehensive health plans for coordinating all manpower involved, and the large number of highly trained and dedicated swimmers always ready to risk their lives to save victims from the raging currents. Sure, it costs a lot, but, say the downstreamers, what else can decent people do except to provide whatever is necessary when human lives are at stake? Oh, a few people downstream have asked the question now and again, but most folks show little interest in what's happening upstream. It seems there's so much to do to help those in the river that nobody's got time to check how all those bodies are getting there in the first place. That's the way things are, sometimes.
So essentially that's what we're going to be discussing today, is the notion of upstream versus downstream. Building partnerships to reduce crime, at its essence, is trying to prevent people, families, situations from getting into the system, any system in the first place. Once somebody gets into the system, be it justice, be it child protection, social services, any type of system for anybody who's struggling with their personal circumstance, it's bloody hard to get out, especially with crime. If you get a criminal record, you know, that follows you. It really follows you. So rather than downstream trying to figure out, okay, what are we going to do after the fact? What can we do to rehabilitate offenders? All that stuff exists. We've been doing that stuff for years, and we do it pretty well, actually. The system actually works well. I'm sure some clients involved in it would disagree, but in terms of the way it's set up, it actually works pretty well. But what's missing is the front end part, is the part about the teacher that knows when she looks at an 8-year-old, 10-year-old kid and sees what he's drawing in class and sees what he's handing in for work and sees that he or she is not coming to school more than one day every 2 weeks. They can tell, they know that little boy or little girl is going to be headed for trouble. But our system has been traditionally set up that something has to happen first in order for the services to get involved. That doesn't really make much sense. We're waiting for something to happen before we're going to act. So a colleague of mine in Prince Albert likens it to, you see a glare ice intersection, and rather than spread some sand and gravel on the entrance to it, we're going to actually spend 10 times as much. We're going to put 4 or 5 ambulances just on standby at the other side because we know something has to happen. A little bit of a facetious example, I know, but that's what we're talking about. We're talking about things that professionals and as people, we know is going to happen. So rather than wait for it to happen, we're actually going to get involved first. But that's not as easy said and done, because in order to do that, you need to talk about people. And we're going to talk about that in a minute. But origin of BPRC, real quickly, from 07 to 09, is a consultation for a shared vision for policing. So in essence, we knew as a province that it's not sustainable. You can throw as many police officers as you want, you can throw as many crisis workers as you want into the system, and unless you actually get somebody at the proper time in their evolution towards crime or victimization or any of that, it's really that much harder to make an impact. So in 2009, the Future of Policing report was tabled to Cabinet, and the Cabinet response in 10, they made a charter commitment, okay, we're going to do something, and we're not just going to throw a bunch more money into the system, rather we're going to really have a comprehensive analysis of how we do our business in human services. And in 2011, release of the research-based public document building partnerships to reduce crime. And Premier Wall's message, everyone deserves a safe environment in which to thrive and prosper. Building partnerships to reduce crime has been created because we need to articulate more than a hope for change. We need to do something about it, and we need to do it together. What strikes me about that comment and why I've included it in the references is in my career, so I've been a policeman for 17 years between Prince Albert and Edmonton, Alberta. I bet you I've heard 1,000 times, more than that, people saying, and the conclusions being, we need to work together. Well, sure we do. But it's hard, so we just kind of say we should and then kind of not do it. Right? Now, it's not to say that there aren't pockets of partnership in every human services. I mean, municipal police departments in the province have collaborative efforts with the RCMP and combined forces and drug units, intel units, good working relationships between policing and social services, for example, evolving and improving relationships between policing and education. And forgive me for always reverting back to policing, it's just my experience. But what we're actually accomplishing, now, with these hubs and other evolving models of collaboration is traditionally unrelated or kind of different systems actually working together with the understanding and with the now appreciation that we're all in this together. They're all of our clients. So if somebody is not going to school, for example, at age 10 or 12 or 14, traditionally speaking, that was not a policing problem. Why the heck would the police care if there was a kid not going to school? Because we're busy dealing with these people that are killing each other, and now we've got traffic enforcement, and we've got all this policing stuff. No, we're not interested in the kids not going to school. Well, now what the research is telling us, and we ought to have known, but we didn't really have an appreciation before, is if they're not going to school, there's a correlation between truancy and crime. So they're going to be our problem. So that's what I mean about being upstream. A kid not going to school is absolutely an issue for the police, because if they aren't going to school, research tells us that they will be involved in crime or victimization. So it was really nice to have commitment from their premier saying, we should work together, and by goodness, you guys, figure it out, because you're going to do it. So the BPRC goal, reducing crime and victimization. Again, a little bit of a policing slant. This infographic illustrates kind of the three prongs that policing use. There's intervention, prevention, and suppression. Now I can tell you from my experience in policing in 2 provinces, police are really good at suppression. That's where we take most of our training. That's where we take most of our experience, that type of thing. Something happens, we're really good at going in, sorting out the mess, putting together a report, sending somebody to court, and then doing it again, because unfortunately that's what happens. Getting better at the prevention pillar, there's some really good community policing initiatives, school liaison officers, they're all good. They're really good, and they're getting better. But where we absolutely drop the ball, in my opinion, in policing is in the intervention. Because policing, traditionally, is so reactive. Something happens, police get involved, and then we sort it out. Even when we know, or we ought to know, something is going to happen where we don't have an incident. So, for example, police officer or social services go to a family's home. and let's say, hypothetically, there was an argument. Police are called, there's no crime, there's no criminality, nobody's being arrested, nothing like that. Traditionally speaking, all's good. Police went, sorted out, stomped out the fire, and backslapping, good job guys, good job girls, let's go to the next one. But what we didn't notice is there's no food in the fridge. There's kids that are in dire need of some type of care or additional care. I can tell you an example that will never leave my mind was that type of scenario in Prince Albert, going to a family fight, what we called it, and sorting it out. Everything was fine. And when I was leaving, I was walking through the kitchen, I looked down, and the dad had set down a pie plate of fries on the filthy kitchen floor. There's 4 kids eating off it. I didn't really think anything at the time, but I mean, because I was in police mode. I was a cop guy. I did my job, and now let's go to the next one. When all it really would have taken would be to just have that in my mind that, no, that's not good. Probably not worthy of a child protection type of thing because, they weren't in harm, and well, technically speaking, they were eating, but that's what I mean about the whole reactive thing. We're getting better now with BPRC and other collaborative efforts, because there's a bunch of them, at really getting into the root of the problem. So BPRC, these are just a few items just to illustrate kind of what we're hoping to really kind of tie together. Now, I apologize for the small graphics, but these hubs are one. And I'm going to get into the hub model more, but I just want to show you that. And I want to take a minute to illustrate the really good work that is going on in the system that people have created and systems have created on their own. So Regina has an 11 and under strategy where they identify youth, obviously under the age of 11, and target them and give them intense wraparound services, and it's a really, really good case management strategy. Serious violent offender strategy is something that's new and ongoing coming out of the province. BPRC will be involved in that as well, and that is about violent offenders in the community that have been released from jail or maybe about to be released from jail, and it's going to hopefully give them, through some type of education and sometimes enforcement, some hope, better hope for success on the outside. Other integrated target initiatives, and the whole idea being that we all need to work together on this stuff. And I know it sounds a little cliche, and I was kind of making fun of it a moment ago, but I mean, you can't just throw more at the system. Sometimes you need to coordinate the system, and that's kind of what BPRC is really hoping to accomplish. And the bottom layer, you can't really see it, I guess, from the rails there, but it says a growing and reliable evidence base. That's something I want everyone in this room to kind of keep in mind, is that everything we do in the BPRC is going to be strongly scrutinized and strongly measured, because all of these things you're seeing up there, the 11 strategy, the SVOR, they're really good services, but we traditionally have missed the boat on measuring them. How well did we do? Is it worth doing again? Is it worth putting more into one of these initiatives because it's showing such good outcomes? So let's talk about the hub. In 2009, like I said, the province was putting together their Future of Policing report. At the same time, in Prince Albert, we created what we call a hub. And the model was adopted from a model that's in operation in Scotland. I don't know if anybody here is familiar with that type of research that was done from the, sponsored by the Prince Albert RIC, or Regional Intersectoral Committee. And they sent some local leaders, local kind of managers and governance on a fact-finding trip to Scotland, and they went to Glasgow and researched a place called the Govan Hill Hub. So it was actually kind of serendipitous that the province and their Future of Policing and Community Mobilization Prince Albert, of which I was a participant in, kind of were going at the same time. And eventually we kind of realized, well, why don't we just kind of get to know one another? Maybe there's something we can learn from one another. So that's what we did. So the hub, I'm just going to really, really broad strokes, and I'll leave open for questions in terms of detail, because there's so much detail and there's so many nuances at every step of this hub model. I'm not going to obviously get into them all, but I encourage anybody to ask a question at any time during this presentation, by the way. So the hub is not case management. That's probably something to kind of clarify right off the bat. Case management exists in the system already, and it exists very well. Social services, policing, education, health, corrections, they all case manage, and they all do a good job of it. But what the hub is built to do is not to case manage, because that would be replicating something that's already in effect. The hub is best described as a discussion. It takes place frequently. It brings key players together bi-weekly, and it only deals with situations of acutely elevated risk. I'm going to get into that a little more later as a definition. But the key word here being risk, because risk is something you can act on before the incident if you know what to look for. The hub rapidly deploys collaborative interventions. It mitigates the risk and connects individuals to services that they may not previously be connected to, or maybe they were but aren't anymore. What it does not do is fix situations. Now, I put that in there because there is a belief in some, in various systems, not just one, that if a hub, or any other actually collaborative model for that matter, is involved with a person or a family or any situation, and it doesn't go well, or let's say there's an intervention that takes place, the services are offered, and you know what, they're still not coming to school. Or, you know what, they shoplifted the very next day. So a lot of those people say, well, the hub doesn't work. Why are we wasting your time on this? You know, you had your chance, and it didn't work. Well, people are complicated, especially people that are in risky, elevated risk situations. It's probably going to take more than a pamphlet. So have to put that in there because it's worth saying. It doesn't fix anything. You can't fix people. You can only give people the best opportunity to fix themselves. That's all you can do. And again, it does not have cases or perform case management for a variety of reasons, the two biggest being that exists already, and there is privacy concerns when it comes to case management. People are obligated, or pardon me, people are allowed to know what's being talked about. If anybody here has any involvement with any system and you want to see what was said about you, there's a mechanism for that. So when we created the hub model, we didn't want to have to duplicate all that stuff because it gets pretty cumbersome. So what we did was create this hub model as a discussion. It's not an entity. It's a group of human service professionals collaborating to mitigate risk. So we don't have case management, therefore we don't have to produce anything when somebody asks about it. That mechanism exists already. If somebody wants to know what social services is saying about them or what is being written about them, they're entitled to know that, and there's a mechanism for it. So why has Hub garnered some notoriety? Well, provincially supported, whole of system integration and collaboration. Now make no mistake, this Hub model is evolving. This is where we want to get to. This isn't exactly where we are. We're in many cases working against a current of many, many years of systems and bureaucracies and that type of thing. We haven't just done a complete 180 and rock and roll, here we go. This is where we want to get to. But a lot of the things that we're seeing and a lot of the things that people are getting excited about to get involved in the Hub is this type of thing. And again, evidence-based, mentioned that a moment ago. There's a bullet there that says breaks down silos. Does anybody, or can anybody appreciate how when we get a complicated system with a variety of issues, a variety of mandates, a variety of resources, how people can kind of get the horse blinders on? All we're interested in is our little piece, and don't bother me with the kid that's not going to school because I'm too busy dealing with shoplifters and I'm too busy dealing with the murder that happened last night because there's pressure on us to get that solved, and the neighbors are, I'm sure everybody can appreciate that. And while that's probably reasonable to a degree, we don't have the luxury anymore because we're only getting busier. Everybody is. Schools are getting busier. Kids are getting more complicated. They're not getting the support from parents that, I know when I was going to school, if a teacher said that I had grown horns and was jumping out the window, my mom would believe her. Absolutely. And, you know, teacher could make up anything they wanted about me, and much as I protested, heck no, go to your room. So that's one of the big things that we're really trying to get to, is breaking down the silos. So understand that you have a part to play as a human service professional in any system for the greater good. Increased client trust. We're getting some reporting back from some clients that are saying they really appreciated only having to tell their story once. So a lot of clients, mistakenly, unfortunately, believe that agencies and systems talk to one another. It's not always the case. Would anybody in the room be surprised to know that personal health records are completely separate from mental health records? And an admitting physician in the emergency room, who is now being tasked with the initial assessment of a person who is presenting as having a mental illness, or maybe they're suicidal, has no access, no direct access to that person's mental health records. In Vancouver, a colleague of mine with the Vancouver Police tells me that even hospitals in the same health region won't talk to one another. They won't share files. They just won't do it. They can't explain why. They just don't want to. Well, it's not that funny actually, but another story that was presented to me from my colleague in Vancouver Police says he recalled being on patrol one night, and he got a call from a charge nurse at one of the hospitals in, I think it was Richmond, it doesn't matter. And she says, there's a gentleman here. He came to visit his newborn baby. We believe he's high, and we have information that he has marijuana on him, and he may or may not have a knife. We don't know that. So they call the police. Great, absolutely. Here we go. So, as police officers do, because we want to know what we're dealing with, asks the nurse, okay, who is this guy? So we can check. Maybe he's on conditions. Maybe he's got something in his criminal record that would indicate that he is violent, maybe, or maybe not. And the nurse said, I can't tell you that. I can't tell you his name. That's health information. He's in a hospital. It just goes to show that people get so blinded and so focused on their little piece of the pie that they won't even be willing to entertain the notion that, you know, you can help me out. And final bullet there allows agencies to focus on core business, yet provide coordinated response. Police can still look after the homicides and the criminal acts and the traffic enforcement. They can still do that because that's what they're there for, and it needs to be done. But then they can also help out, just to know that you can provide a coordinated response. You can help your colleagues in ways that you probably hadn't thought of before. So here's where we are with Saskatchewan Hubs. I think that's current. Oh, sorry, Melfort. Just started, I believe, about a month or so ago. We'll get into this a little bit more in terms of the nitty-gritty of hubs. But it's evolving, like I said again. There's a lot of communities that are interested in the hub, and it's part of our job with the BPRC to figure out if it's going to be a success or not. Because, as I was explaining to Bruce a moment ago, you saw on that slide a moment ago that one of the operations coming out of a hub is to offer services to somebody that may not have had those services before. Well, it's a little bit of a paradox when you go to somebody who's presenting at acutely elevated risk, saying, I'm here, I work for the police service, or I work for the RCMP, and I'm a member of the hub, and we know that you're struggling, and we want to offer you some services. It's kind of frustrating to say, yeah, we want to offer you services when you don't have them. So if you don't have a mental health worker in your community, and somebody is at acutely elevated risk, and you want to offer them some mental health services, it'd sure be nice to have those mental health services. That being said, it's the reality that in some communities, based upon their size or capacity, some services don't exist. That doesn't mean you can't work together. It just means that maybe a hub might not be the ultimate solution for you. Because one of the things that I'm afraid of with a lot of these communities is if you set something in motion and it doesn't do well, sometimes it's hard to get it back. So part of our job with the BPRC is to make sure that we give a community every opportunity to succeed in whatever endeavor they do in collaboration. Oh, they're interested. Regina's has a lot of other things I think they want to sort out first. Like I said, they have that 11 and under program, and I think they are developing kind of a, not a cousin, but evolution of that, like 12 and up. Yeah, we've had conversations with Regina, but they just want to sort out some of their first things that they're trying first. So as I said a moment ago, one of the expectations coming out of the Ministry of Justice, and actually all ministries for that matter, is it's not good enough to just offer the service and to just limit yourself at the operations, because it's good. That's only part of the plan. What we need to do is measure this thing very carefully, because there is no better mechanism to measure what type of risk or what patterns of risk are going on in any region of the province than this hub model, because quite frankly, it is data that is raw, and it's absolutely reliable because it's real. It's not someone's interpretation of what's going on. It is actually being fed by the people that sit at a hub table. So it's not being amended in any way. It's not being sanitized in any way. What the hub measurement does is it measures the risk, not the people, because we don't need to know about the people. The case managers in each partner agency know of the client. What we're interested in is capturing the risk. So if John Smith is struggling with addictions, having some mental health concerns, he's about to be kicked out of his house, and let's just say he was robbed last night of his wallet or whatever. That's one client. It's important to know because we want to help Mr. Smith. But now we know 4 risk factors that he's facing. And now multiply that by 100 people. Now you know, have a much better illustration of what type of risk is going on in the region. And I'll give an example. I don't have the exact number, but I grew up in Prince Albert, and I'll apologize to anybody else that's from PA here because I'm about to besmirch our fine town. I always knew PA had a drinking problem. I always did. I mean, I policed there for more than 10 years. I grew up there. I always knew that. But I didn't know it to the degree until we actually started dealing with these hub issues. And I think it was something like 63% of people coming to a hub were struggling from alcohol in one form or another. Well, that's way more than I thought. And it's not something that you can compartmentalize or conveniently dismiss as, well, that's those people, not us. No. It's everybody. And it was manifesting itself in things that were becoming problem, and they were tragic. We had people that were, I think we had 4 freezing deaths a couple of years ago, and there's some good things that have come out of that, but it wasn't really until we actually had the hard data that you can actually hang your hat on that we could say, okay, this is how bad it is, and now we really need to get something to get on top of this stuff. Every hub in Saskatchewan uses the same data system. It's a Windows, actually comes out of customer relations management that our geniuses in the tech support office of the Ministry of Justice have tweaked for our needs. And it only contains de-identified information. So there's no people. There's nobody in there that somebody could look at and look at 4 or 5 risk factors and think, oh yeah, that's John Smith. I know who you're talking about. It's consistent. Everyone in the province is doing it the same way. It's housed in the Ministry of Justice, probably harder to hack than Sony. And the data is available for analysis at the local, regional, and provincial level. And that's kind of what it looks like. So, again, just to reiterate, and I don't want to sound like I'm beating a dead horse, but one of the common misconceptions is that this hub model is just a real big brother type of initiative. Well, it's absolutely not. It's about intervention, mitigating that acutely elevated risk, and not only that, learning from it, finding out, okay, what are we dealing with, and to what degree are we dealing with it? So we call them discussions. We don't call them cases. Any item that's brought before a hub and anywhere in the province is a discussion. It's not a case. It's not a file. The partner agencies hold those files. A hub doesn't. We track who the originating agency is, number of times discussed, all these types of things that are giving us a clearer picture of what we're dealing with in the province. Because we think we know, but we want we want to really kind of something to hang our hat on. We have 102 now risk factors that have been kind of an evolutionary process. We don't want to make them too, I guess, nitty-gritty. I mean, you can get really bogged down in minutia if you really wanted to in terms of risk. So we, in partnership with our hub partners across the province from various agencies, have kind of nailed down, well, it doesn't really sound like it at 102, but nailed down kind of the most that we can get in terms of detail, but not getting bogged down in too much stuff. And again, it's just risks, not people, just risks.
So are you finding the same risk in all in your different hubs?
No, and that's the interesting part. And I'll touch on that in a bit. Well, I'll touch on it now. We're not. Prince Albert, per person, spends twice as much on alcohol and has alcohol as a risk twice as much, 2 times the amount as people in Moose Jaw and Swift Current. L'Orange, just by their hub activity, has really noticed, and now that because they've noticed it and they've been talking about it, that cognitive disability is a real problem in L'Orange. They probably kind of knew that before, but not to the degree that they do now. So much more of a problem than, say, Swift Current. Saskatoon, housing. You know, we probably could guess that would be accurate, but, you know, that it's housing. So to answer your question, no, they're completely different. And then one of the things that we can do with that is we can align our service delivery accordingly. So if parenting and alcohol abuse, which are Prince Albert's 2 main risk factors, then you know what? Maybe we can reallocate some of the money that's going into parenting and alcohol abuse programs in Moose Jaw, send them to PA, and something that's going on in Moose Jaw that's more prevalent than in PA can kind of be realigned that way. Now that's where we want to get to. There's obviously it's not that simple because you're talking about a whole bunch of layers of bureaucracy, but I mean that's kind of what we're looking for. So which speaks to the importance of measuring this stuff so that we know we can see what's going on and we can react accordingly in terms of services, in terms of you know, measurement or anything. This is the big one. I'm sure everybody can appreciate. When you talk about people without them initially knowing, you are tiptoeing very, very close to infringing on their privacy. So as such, very early on in, actually right after the kind of the marriage between Community Mobilization Prince Albert, which kind of became the what we call the proof of concept model for this whole collaborative intervention topic, province met with us and said, okay, the work you're doing is great, but we got to clean it up. We need to make sure that it is absolutely in compliance with all the pieces of legislation that have to do with privacy. So for health, there's the Health Information Protection Act. For schools, there's the Local Authority, Freedom of Information. I think there's about 6 or probably 8, maybe even more. And one of the things that we learned when we were doing that exercise was that in all of the legislation, after pages and pages and pages of saying, thou shalt not, don't you dare, if you do this will happen to you, there's one little line in many cases that say, except if there's somebody that's going to be a harm to themselves or other people, then you can talk about that person, but only to the degree that you're going to help that person. You can't, you can't disclose everything about that person, but only what you need to know. So we took those 2 lines, and we clung pretty hard to them. So the Interministerial Information Sharing Issues Working Group, or ISWIG as they're affectionately known as, comprised of Justice, Health, Social Services, and Education. Essentially, those are the people that were tasked with, this is where we want to go from the government, this is where we want to go, you tell us how to get there. Don't tell us we can't, don't tell us what we can't do, make sure you come up with a way that we can do this. That's going to be legal, it's going to be ethical, and it's going to be respectful. And they did. And in 2013, they drafted the Interim Information Sharing Guidelines for Community Mobilization and Hubs. I'm not surprised by it, but I think people would be surprised by the amount of human service professionals that don't have a fraction of the knowledge that they ought to about their authority for sharing information. There is a lot of leeway for sharing information in certain cases. And I spoke about them a minute ago. If someone is presenting as a threat of harm to themselves or others, even the Supreme Court says, yeah, if somebody is matching that criteria and you can prove it, yeah, you can speak about them in a very, very prescriptive way for the purpose of mitigating that risk. You can't talk about their uncle's business that went bankrupt 2 years ago, but you can talk to them. You can say that, you know what, yeah, they were assaulted night before last or something like that. Any questions to this point? Sorry, it's a lot. Okay. So what was the guidelines for? Well, quite frankly, it was kind of the guidebook to do what we are asking communities who are interested in the hub model to do. Assisting human service providers to understand their privacy obligations, because with great power comes great responsibility, I guess, so they say. So, yeah, you can talk, but you better be careful and you better know what you're doing. So that's what this booklet did. Sets out privacy legislation in Saskatchewan, confirms parameters where information sharing is permitted, and it's tight. It's extremely tight, those parameters, and they should be, because I know how I would feel if somebody was talking about my family without me knowing it. And it outlines the four-filter approach. We're going to get into that a little bit. I have included that because I think that four-filter approach that is used as a kind of an operational mechanism for every hub kind of helps to kind of tie it all together. So I spoke a little while ago about acutely elevated level of risk. It was really, really hard for Community Mobilization PA and the ISPIG group to figure out, okay, we're talking about risk, but risk has different meanings for everybody. Not even about what agency you work for, just even personally. There are different understandings of what it means for risk. So I'll give you an example. One of the early hub discussions in Prince Albert, and I won't name the agency, but there was a young man who was suffering, well, I shouldn't say suffering, he was presenting with some suspected mental health issues by the police, because we're not mental health professionals by any stretch, but you can tell when someone's struggling with their mental health, and he was. Recently released from the correctional center with no supervision, just he served his time and he was done. He was living under the bridge, under the Diefenbreker Bridge in PA in the wintertime. Well, to me, that spoke volumes about risk. Something bad is going to happen to this guy, like now, unless something happens to him. And there were people, I'm not going to name the agency, that disagreed. They said, no, I think he's okay. I don't think we need to talk about this guy. I am more reluctant to speak about this gentleman without him knowing than I am about letting something bad happen to him, because then, this is just my interpretation, then I'm protected. So it's not about him, it's about me. That's one of the biggest things that we've had to overcome with this whole notion of acutely elevated risk. We need to start focusing as systems on the client rather than satisfying our system, because unfortunately that's what we were really, really good at doing, and we're getting better at getting away from that. So acutely elevated level of risk combines the degree of probability of harm, also with cutting across multiple human service disciplines. So, not to oversimplify it, something really bad is going to happen very soon, and no one agency can look after all of this complex, all these composite risks that people are dealing with, because unfortunately, it's very rare that someone suffers from one risk variable. It's very rare that somebody suffers from mental health without an addictions component and a victimization component and a criminality component. In fact, I don't think I've seen it, and I've been involved with the PA Hub for, I think, about 1,200 discussions now, and not once has there been somebody brought to a hub that suffers from one risk variable. It's never happened. So that's acutely elevated level of risk. Are there any questions on that? Because it's kind of oversimplified in that graphic, but that's kind of the bare bones of it. That's That's the definition that we came up with that somebody can then look at and think, okay, that's what you're using as your threshold for acutely elevated level of risk. So this is, again, is also kind of oversimplified, because obviously someone's path to increasing their risk and increasing their path to harm is different, and it's also very personal. But typically speaking, as somebody going through their life, going through their personal situation, encountering these risks, it kind of goes along this kind of spectrum. It starts kind of low, and as you get older, or as the risks become more complicated, or you enter into the system and now you have some more kind of obstacles that you need to get in the way, it grows. It's evolutionary. I think that's fair to say. And traditionally speaking, this is kind of, again, oversimplified, how the system kind of works. There's some very, very good work done in primary prevention. So that's, education, public service announcements, that type of thing. And as somebody gets a little more into the system, there are traditional services. So if somebody is struggling with addictions, there's services for that. Mental health as well. All that stuff, it's all available. And then what I have there is what they call the mandated response. So there's a point in someone's situation where agencies need to get involved. The discretion is kind of taken away. So I'm talking child protection. I'm talking about kind of more significant or higher degree criminality. The police have the discretion with a fairly low level type of criminal incident to defer them from court, that type of thing. But there are, unfortunately, certain situations where mandated response is required. You have to get involved. You just have to, professionally and ethically. Here's kind of where the collaborative intervention takes place. Now, I wish it was a little closer to the yellow, personally. But in terms of being compliant with privacy and people's right to privacy, because it's important, everybody's entitled to it. That's one of the kind of the foundations of democracy is privacy. There's kind of a sweet spot there where it needs to be bad enough that we can articulate and we can show why we would talk about somebody without them knowing it, without the mandated response needing to be put into place. So there's still some discretion. For now, it's there. I'm hoping as we refine this model and as other collaborative intervention type models get rolled out and this becomes more of the norm of business rather than the exception of business, gets a little more to the middle, because you're still too close to the mandated response. You're still, in my opinion, we're still too close to the tragedy or the incident, so be it an arrest or an apprehension. But for right now, here's kind of where we've agreed, okay, this is where we can properly articulate why we're going to talk about somebody without their consent. And on that note, I don't want to give anybody the impression that we're telling secrets or that anybody in a hub is doing something that, they're really, really tiptoeing close to being kind of out of line or being in breach of something. Actually, as a matter of fact, in my opinion, it's just my opinion, the hub model is the best way to get someone's consent, because you're not going to come up with a plan or a risk intervention type of rollout without that person's contribution. You're going to involve them in it every step of the way and as early as you can. So in a way, actually presenting a discussion at a hub and then ultimately going out very, very quickly and then talking to that person about what's going on in their life and connecting services, in my mind, is actually a very good way to get consent. So that you're not just going to wait for something bad to happen and then kind of impose our will as government agencies. We're actually going to give them a say on what's going to happen in their destiny. They're actually going to have a part to play in their life, and I think that's respectful. So I'm going to go through the four-filter approach here. Now, I don't want anybody to get too worried about this, but it's worth showing in my mind because it shows the evolution of a discussion at a hub table. So the first filter, quite frankly, is an agency understanding that they alone, as an agency, can't address a person's risk situation by themselves. Despite their best efforts, for example, policing, and I'll use policing because that's my background, we can do criminality very well. We do it very, very well. We're trained well, and we have a lot of support, and in many cases, a lot more resources than other agencies to deal with criminality. Fair to say. But we see and we deal with a lot of risk situations that we don't have resources for, that we don't have experience, and quite frankly, we might make things worse if we thought we did, and we tried to act on those. So the first filter, quite frankly, is your agency has done what it can for this risk situation, but you can only do so much, and then you want other people to help you out. That's the first filter. So no discussion will even be brought up at a hub table unless an agency has shown that they have done what they can, and there's still all these composite risks left over. Second filter is an agency presents a situation to a hub in a de-identified format. So at this point, no names are disclosed. No, we're not talking about a person here. We're talking about a scenario that we are asking people to present in a way that you wouldn't be able to identify the person from the risk situation. So, because it's fair to say that, you know, you can talk about a mid-30s male, receding hairline, police officer, green suit, and but we're not going to tell you his name. Well, you know. So, second filter is about, we don't use ages anymore. We use age cohorts. So that, again, provides a little level of protection or to their privacy. So we don't say a 14-year-old girl anymore. We say a youth, female youth. Then potential participating agencies are identified. So, for example, and I always use this one because it's kind of near and dear to my heart. Youth female, police picked her up last night, passed out intoxicated in the snowbank. It was minus 30. Went to take her home. There's no parents at home. She has bruises on her, indication that she's been either being recently beat up or is harming herself. And she hasn't been to school in, well, this year. And I guess I'll poll the room. Would that be a situation of acutely elevated risk? Fair enough. So second filter is de-identified. The table has to agree that, yes, this is a situation that is significant enough and is bad enough that we need to talk more about it, and we need to identify this person so we know who we're talking about. So the third filter is the bare bones identification of the person. So in this case, it's going to be Sally Jones. Her date of birth is January 1st, 1999. And limited discussion is taking place at that point. Only necessary information. Speaks to the need to know. So privacy exemptions for speaking about somebody without their consent includes a provision of a need to know. Only those who need to know about what's going on hear about it, are going to deal with it. Notes are only taken by participating agencies who need to continue to be involved. And then the first question that's asked is, do connections to services actually exist now? Because if the hub is going to talk about people initially without their knowing about it, with the intent on connecting to services, then the rationale that we came up with was, if they're already connected to services, let's not talk about them. Let's actually engage the agencies that are connected to this person, fill in those agencies on what's going on, and then they can adapt and they can adjust their whatever case management or their file management regarding that person accordingly. So that you don't need to talk about them here because they're already connected. And again, still, the question that is always reminded of people, are they at acutely elevated level of risk? And I'll use this situation because a lot of people, this is where a lot of the discomfort comes with the hub process, is because this is the part where you're actually talking about somebody without their consent. And I'm going to give you an example, and it's completely true. There is a gentleman in Prince Albert, city of 38,000 or however many people. He is my age. He is bald. He works for the government. His wife has the same name as my wife. His wife's middle name is the same as my wife. His name is Matt Gray. He's a teacher. That poor so-and-so gets more calls for me than I can't believe. I owe that guy something, because think my brother even phoned him one time, and they actually talked for about 2 minutes, so he must even sound like me. But the point being is you need to know who you're talking about, because the paradox with this filter is that what if you go to the wrong John Smith and you say, hey, John, I know you're dealing with mental health and I know you're struggling with this and that. What if you went to the wrong one? And you just told the wrong John Smith that the other John Smith is an alcoholic and he just got arrested for shoplifting and. So that's kind of the need to identify. But again, very, very rudimentary identification. Only identification to the degree so that we know who we're talking about and we can come up with a proper plan. And then the fourth filter, which actually kind of, we didn't come up with, it actually kind of came up with itself, was the full discussion of what's going to happen to Sally Jones or what's going to happen with John Smith in terms of a risk mitigation strategy. What are we going to do is only shared among the people that are going to do it. So if the police are not going to be involved in any risk intervention strategy, then the police don't hear about what's going to happen. Only the agencies that are going to be involved in the risk intervention strategy are purview to those discussions. The question is then asked, is multi-agency action required? And usually, almost always, it is, because otherwise it wouldn't have passed the hub screening process. And if yes, participating agencies intervene to mitigate elevated level of risk and connect to services. Now, again, I want to reiterate this here because it's important. We're still in the intervention phase here. The hub does not case manage. Nobody in a fourth filter risk mitigation or intervention meeting, however that takes place, because it's up to those folks, those professionals, to decide how that's going to work. So that could be or a family conference at the school, could be a coffee at, an empty Tim Hortons, whatever. Whatever's going to work for that client is what is expected. And again, only those agencies that are involved have the discussion. During the report back, so for example, the Prince Albert Hub meets Tuesdays and Thursdays, so does Saskatoon's. If there's going to be a fourth filter, if there's going to be a risk intervention meeting, so let's say it takes place on a Wednesday, on Thursday, those people will report back, but they don't go into detail. They say, according to the database, a few conclusion kind of blocks. So they were either connected to services, they were offered services, or they kind of refused them. Now it goes into a little bit more detail than that, but they don't say, okay, she's been hooked into this, and she's going to do this, and then we have a meeting this. We don't need to know that. The case managers need to know that, and they will. But the hub table does not need to know what's going to go forward with that person. Are there any questions on that? We're going to be done here early, guys. Some of the next steps, because I've said a few times that this hub model is evolving. Saskatchewan is developing and enjoying a very close partnership with the province of Ontario. Ontario has researched the Saskatchewan hub model. They like it. I think they have about a dozen or so hubs themselves. I think Guelph has one. They don't call them hubs. They call them situation tables. But I think Guelph has one, North Bay. There's one in Toronto. Well, I shouldn't say in Toronto, in a neighborhood in Toronto. And what we're doing with that is that Saskatchewan isn't just feeding Ontario what we've learned. It's a real good partnership. And coming out of that is a development of an e-learning module. It's called Moodle. I don't know why they call it that, but it's a computer program. And basically, what this was born out of was there was a lot of interest in this hub model. And quite frankly, it's a problem when somebody wants to learn your model and having them sit in a live hub discussion. I mean, by doing so, then they would be present for discussions that don't involve them, that they should not be hearing because they're people. But we also understand, though, that the best way to learn this type of model is to actually do it. So we met in the middle. There's an e-learning Moodle that it's a course that has been developed, and it's got a forum component to it as well, that if you are taking this course, if you have a question or if something doesn't make sense, you can write your question, type it out in a forum window, and somebody, either in Saskatchewan, Ontario, who is part of this environment, can then answer for you. So that way, we're getting all the benefits of the hub experience from people that have helped to develop it or who are currently involved in one, without actually exposing people to clients. So we're keeping them kind of sanitized and safe that way. So next steps, again, evolving, ongoing attention to privacy impacts and development of operational protocols. We will never, ever stop doing that. Anybody that will ever be involved in the BPRC or even participating in a hub for that matter, we will never, ever stop scrutinizing ourselves and everyone else for that matter to make sure that these privacy impacts and people and their privacy are being respected at every step. That will never stop. We'll never ever get to a point where we think, okay, we've got that cased in and we'll move on. That will always take place. Again, I mentioned a growing partnership with the province of Ontario. Ontario, interestingly enough, uses the exact same database as we do in Saskatchewan. And we have an agreement with them that whatever improvements or supplements or refinements that they make to that database, they will share with us for free. And education and consultation with Government of Saskatchewan ministries. I spoke a little while ago about people not wanting to work with others. Unfortunately, that's not exclusive to agencies. That exists in the ministry too. There's some ministries that they just kind of want to just kind of do their thing, and like they appreciate this, but they're just really not sure how we're going to go about getting there. Well, we in Justice have kind of taken the lead role. It's not a responsibility, but kind of taken the lead role to really encourage and really increase the inter-ministerial communication so that Justice knows what education's dealing with, and vice versa. And by way of the child and family agenda, some of the assistant deputy ministers at that level are really getting some, well, outstanding operational models coming out of it. Health has some things that are going to be, well, going to save people's lives. Same with education. Just basically so that everybody at the ministry level understands that we are there to support one another, and we are not there to scrutinize one another, but rather to leverage each other's expertise and experience. And I've included here, this was a quote from a gentleman out of Ontario. He used to be in charge of the Canadian Police College. He says, the goal of every hub should be to work itself out of business. Hopefully, and hopefully at some point, hopefully in my career, it won't be a standalone model or a standalone initiative that will compel people to work together. Hopefully that becomes just the way business works, so that when I'm a police officer and I'm dealing with a kid who has shoplifted, because it happens every day, it's happening right now as we speak, a kid who has shoplifted a sandwich and a Red Bull, because it happens all the bloody time. Rather than being the cop and doing the court brief or doing the alternative measures referral or something that's just in relation to the incident of him shoplifting, I'm actually going to take a minute and I'm going to wonder to myself, why did you steal a sandwich and a Red Bull? Do you have food at your house? Because before I never asked that question. I got called to Superstore, and I approved the loss prevention officer's report, and I approved his grounds that they were legal, and he's done everything according to the criminal code in terms of effecting a proper arrest. And here you go, sonny boy. Here's your court date, and I have a notice to parent that I have to serve on your mom. And I never ever asked myself, why did you shoplift a sandwich? Never even occurred to me, because that's not my job. It's somebody else's job. That's social services' job. So that's hopefully where we're going to get to, is every time anybody in any human service agency is going through their business, when they see something that they recognize is wrong, and they don't have the expertise or the resources to properly deal with it, they will have a whole bunch of new partners in other human services to leverage, to lean on, to ask for advice, and to ultimately work with, to figure out, okay, it's not good right now, what can we do to get back on track? And quite frankly, what do you need? What do you need from us? Because you know what? It's too expensive, and it's harming too many people to just let it kind of go just by individual agencies. Question there?
Matthew, resounded from bigger question. The fellow under the bridge.
Mm-hmm.
Now, let's say if Hub didn't exist, you were down there, you saw him, you felt compelled as a police officer to do something personally about it.
Mm-hmm.
That would be wrong, but in that case, if you did something about it, what would happen? Like, let's say you just picked him up and said, look, you got to come with us.
Mm-hmm.
I'm going to find you a place. You
Mm-hmm.
know, every one of them, I believe police officers really feel this hurt inside that they can't always do what they want to do.
Mm-hmm.
So what happened there, or if you can tell me anything, what happened?
Well, unfortunately, that one had a very tragic ending. That guy ended up murdering somebody. Now, I'm not going to sit here and say that had Hub existed, he wouldn't have done that anyway. But what I will say in terms of keeping with what I've been speaking with you about is, if he had been 10 years old, because that was not the first time that he did something that got him into the system. You know, there's a lot of research coming out now saying that, you know, at age 10, in many cases, it's too late to actually properly intervene and get somebody who's in a very high-risk situation back on track. So what the research is now telling us is that prenatal is actually one of the best places to intervene in acutely elevated risk, because you can tell what somebody's life is going to be like based upon what their situation is, or what their, you know, what the mother's situation is in the maternity. So, for example, there's another initiative that's about to be rolled out where there's going to be a questionnaire that goes into every maternity room, and it's not going to be, oh, we're you know, to scrutinize you, or we're building a case that we're going to take your kid away from you. But we know now that 10 years old in many cases is too late. In many cases, 6 years old might be too late. That's 6 years of real hard life, hard miles that somebody has, you know, lived through. And that's not to say that we would, you know, give up on a 14-year-old or even a 30-year-old for that example. But the research tells you the earlier you get involved, the better outcome you can expect. So to answer your question, had the Hub existed when the young fella under the bridge? No, his risks were so high in everything across the board. It would have taken a bloody miracle to really get him back on track, or a complete deprivation of his rights in order to prevent that tragedy from happening, because he was just so far gone. And it is a tragedy, because you know, I met with that guy, and he was lower functioning, but he was a decent guy. So, yeah, I mean, traditionally speaking, the police would have talked to him, probably taken him to, you know, the transitional housing. You know, in Prince Albert, it's our house, if they had room, you know. Or if he was intoxicated, maybe offer him detox, again, if there's room. So basically, like that video at the beginning showed, we can do lots of work on the back end. There's tons of work being done on the back end. So, you know, court, detox, all this stuff at the back end, treating kind of the symptoms. Well, what we want to do is get to the front end. And we want to know, okay, this is where we can reasonably expect it's going to go, and let's intervene here rather than patching it up at the back end. Was there a question over here?
Excuse me, just 1 second, please. We're going to try, just a reminder, we're going to try and use the mic.
Oh.
We are trying to audio record this for everybody, so although we do have a small crowd and we can hear each other, it's for the benefit of those who want to hear this session later. Thank you.
Okay. Lonnie Call from Yorkton. I think the Hub is working extremely well. We are very happy with it in our city,
Good.
and the collaboration that we're getting from the different agencies. But I think some of the underlying problems still become one where you know what needs to be done, but you can't get the client to, whether it's counseling, whether it's drug rehab, and a lot of these issues are drug addicted related or mental health related, to make sure they take their prescriptions, make sure that they do these things. So I guess
Right.
just a bit of a question about that side when it comes to human rights and privacy you were speaking of. Sometimes they're not of their logical mind to make the right choice, I guess.
I absolutely agree. Yeah. And that was something, that's a great point. That point is very difficult for a lot of people that aren't kind of frontline service providers or people that have had personal or professional experience with somebody living through those situations to kind of understand. Unfortunately, for a lot of people that make the rules of engagement for a lot of these frontline services, don't have as good an understanding of just that. Something as dynamic and complicated as free will. People are still in charge of their own lives. And like I said a moment ago, from Bigger, you said?
Yes.
Yeah. Unfortunately, well, I shouldn't say unfortunately. Fortunately, we live in a democracy. We live in a country where we are in charge of ourselves. And I agree with 100%. There are people that, for various circumstances and various reasons, I don't believe are in a mind frame at times to make the proper decision. And again, evolutionary process, this whole hub model. One of the things my colleague Anna from Saskatoon is in the front row. One of the questions that keeps coming up is this whole notion of follow-up. How do we make sure that they went to the appointment? How do we know that it was beneficial? Well, in my mind, you still have to trust one of the professionals. So if somebody from social services says, or somebody from addiction services, yep, we met with them and it went well, I'm not going to ask them what was said. I'm not going to ask them to prove that it went well. I'm going to trust them that. If they say it went well, they're the professional in that certain environment, and I will trust you. And the follow-up can take place from those agencies. It doesn't have to happen with everybody present in a hub discussion. It's a great question. Question there?
Matt, Rick Orr from Prince Albert.
Hi, Rick.
You have a great example on the website that was talked about of the gal that you found in the
Yes.
snowbank.
Yes.
Could you maybe explain how that outcame?
Sure. Yeah. That was, I think, Rick, our fourth or fifth ever hub discussion ever. So that one was the fifth one actually in the country. And that one came to light from education. This young girl was a good kid. I shouldn't say good kid because they're all good kids. She was regularly attending school. She had a pretty positive outlook while she was at school. That wasn't perfect. You know what? She skipped school sometimes, as you know, a lot of kids do. But it was actually her teacher that noticed there was a really abrupt change in her demeanor. She was falling asleep in class. She was moody. She was very sad. And it just was a real stark departure from what she was like before. Now, traditionally speaking, you know, the educator would, you know, offer her to go talk to the counselor, or, you know, really good teachers would sit with her and say, you know, just like I described, hey, I've noticed you've been a little bit down lately. Is there anything that I can help you with? Well, we had a hub at that point, and it was kind of really novelty, and so this teacher said, yeah, you know what, I'm going to try this one out at this hub table. Well, so we talked about this discussion, this girl, and everyone that was privy to that discussion went back and checked their own agency's involvement with this girl. And I was actually the police officer involved in that matter, and I was working for the PA Police's Family Protection Unit at the time. And so I checked into this girl, and I checked into her mom, because this girl didn't really have much. But what I learned from that was that you know, her mom was clean, nothing. She had nothing. This family was squeaky clean. So we're really kind of head scratching, thinking, cripes, what's going on here? We don't know. So we called a meeting, and it was, I believe it was Addiction Service. Yeah, it was Addiction Services that called the meeting, because they had the connection with her. She was seeing a youth addictions counselor, and by all rights doing pretty well. She was making most of her appointments and seemed to be doing quite well. And it wasn't until we had you know, the multidisciplinary meeting, and it was just a sit-down in one of the boardrooms of the Macintosh Mall in PA. And we kind of got to talking, and I could see that Mom had a bruise right there, big one. And so, they're insisting that, no, things are good, and no, things are okay, with both of them tears welling up in their eyes, and you can tell, no, things are not good. And so I just asked the question. I said, how'd you get the bruise on your neck? And she tried to hide it. But I said, how'd you get the bruise on your neck? Well, the girl burst into tears, like fell right apart. And long story short was this mom was in a relationship that was as abusive as anything I've ever encountered in my career. And on the evening in question, when she was found passed out on the snowbank that I alluded to earlier, that night, about an hour before, this mom's boyfriend had a belt around her neck, and said he was going to kill her. And so what we learned from this was that anytime this mom was being abused by her boyfriend, the girl would take off and put herself in a vulnerable situation because she didn't know how to deal with it. So, long story short, one of the best files I've ever worked on, in fact, one of the most satisfying files I've ever worked on in my career, this guy was sent to jail for over 2 years, which is pretty significant for something as trivial, I hate to admit it, as a spousal assault these days. And I won't get into that because that's just my opinion. But yeah, and the moral to that story is you don't know what you don't know. You can only help to the degree that you know what's going on. So yeah, I don't know, Rick, what would have happened with that young lady or her mother. I will tell you, though, that in family protection investigations, the research tells you that once the violence gets to the degree of choking, homicide is the next step.
Well, and that's a positive outcome, and that's what we're seeing in PA. The stats have just gone totally in the right direction.
Yeah.
And it wouldn't have happened without the hub. I'll give you an example of what we deal with. Last weekend, we had, Moose Jaw had 71 calls for police services. We had 217. They had no alcohol related. Over half of our calls were alcohol related.
Yeah.
So alcohol's become a really big deal in our community, and we have a strategy that was put out by the hub to bring our community together. And if it wasn't for the experts at this table, I don't think we would be at the implementation stage. We've done the stats, and we're just about to move to the implementation stage.
Yeah.
And why I came here today is I wanted to find out how this had reached out to other parts of the province, because it's only, 4 years old?
Yeah.
5? 4?
Yeah, 4. Yeah, February 4th, actually, interestingly, CMPA, Community Mobilization Prince Albert, is celebrating its 4th anniversary on Tuesday.
Yeah.
Yeah, so 4 years.
Yeah, and we're unique because we're a hub, right? We're the city itself is like Saskatoon, a hub city, but we're the gateway for the north, going south and north. And we've got some unique things happening. Yesterday, it was great pleasure, after you heard that we had 4 deaths in the winter, we had the federal government, our MP, Randy Holback, our provincial government, come together and fund an initiative that allows people to get out of the cold, the most vulnerable. And these are people that don't want help. They've got mental issues, they've got alcohol, substance abuse, they just don't want help. But another part that has come out of that is we have 5 people last week that are the most vulnerable that were taken out of their situation and put into rental properties. And there's 5 more this week that they're working on. There's about 60, I think, in jeopardy at any one time that we call habitual.
Yeah, oh yeah.
120
absolutely.
roughly that are always in front of our police officers. But now they have some options, and we've never had that before. And I don't think 4 years ago, if we hadn't had the hub, we'd be where we are today. So I think it's a focus of the community, and that's what I wanted to say. If it wasn't for professionals like Matt and the ministries and support from all levels, I don't think we'd be where we are today. So thanks, Matt.
Well, thank you for that, Rick. And I guess the last word I want to just impart upon all of you folks is that the measurement piece is very important, and yeah, the numbers have come down, and they're trending really, really well. for me, having been part of the hub right from the very, very first awkward meeting where nobody knew what to do, don't discount the statistics, set them aside for a minute. Just the fact that there is now a mechanism and an expectation and a groundswell from communities to have their human service people working together and to have human services knowing each other by their first name rather than social services or, the police, if there's a police officer in uniform, the police, or that's Jim and that's Stacy. And you make those connections and you trust one another better. So if you have a community that you have people working together, you're already in better shape than a community that 10 years ago, it was agency, agency, agency. Now it's people working together. And that's the really remarkable part is there are some extremely intelligent, gifted people working in the front lines that we aren't tapping into enough. And that's one of the personal, I guess, testimonials that I've enjoyed from this hub. This whole experience is just actually getting to know people that work in different environments and appreciating that the police aren't the only busy ones. Everybody's busy. Absolutely everybody. So thanks.
All right, we do have approximately 5 minutes left, so we do have time for a couple more questions. But I do have a question, Matt.
Sure. Yep.
Should you be asked to set up a program like this in a community or in an area, for example, in northern Saskatchewan,
Yeah.
all the necessary agencies and services may not be available within that
Right.
small hub area?
Yeah.
Do you have the capability or the ability then to ask for outside help to be brought in?
Do you mean influence in government?
Yeah.
You know what? I don't think so. Personally, Bruce, no. I don't even work for government. I work for the BPRC, which is housing government. I get paid by the PA Police Service, and in 6 months' time, I'm going back to the PA Police Service. So what I will tell you, though, is the BPRC acknowledges that every community is different, and every location has different strengths and challenges. And the task that we've kind of placed on ourselves is hub is one model. There are lots of other things that can be done in consideration of capacity in a community and availability of resources. If not a hub, that doesn't mean that you still can't work together in some way or fashion. And it has to be something that's going to work, because if you set something up for failure, like I said a minute ago, or if you have something that it's unrealistic that they're going to achieve the outcomes that you want, it's really hard to get it back at a later time, because a lot of people see something, if it doesn't work one time, then it won't ever work. Please. Yep.
Just another thing that I want to mention to that piece too, Bruce, is the fact that it is community-led in that piece too. So it is that model, like the unique differences of the communities play out. So for example, in Laurent, because they have support of, for example, a CBO more prevalent with kids sport, right?
Yes.
So they actually sit at the hub table, and that's a unique place where they sit there because they actually are contracted and provide a lot of the services in one area. So they actually are involved in that capacity, and that's how their hub table develop. So I think it's important, and kind of our role too, is to support communities in looking at what are some of the challenges maybe implemented in this model, what are some creative solutions to that, what might be some considerations to think about in actually going forward with something like the hub model.
Right. So bottom line, whatever community chooses, it has to work. Right? Okay. First, sounds overly simplified, but that's the way it's got to go.
All right, thanks. Anybody else got any last questions? If not, I want to take a minute to thank Matt and the presentation. It was excellent. Thank you very much.
Thank you. No, my pleasure. Thank you.